an international medical graduate, and I'm currently working at a research facility in Newport Beach. Today, we're going to talk about the introduction to basic medical terminology in Spanish. I'm going to try to make this as interactive as possible. I will try to keep you guys engaged. My goals is that you guys leave this classroom with at least one or two tips that is going to help you guys be able to understand the Hispanic community, but also be able to speak certain words in an easier way. Especially in the medical field, a lot of the words are from Latin or Greek, so they're gonna sound very similar, or they're just gonna have one or two letters different in English and Spanish. So a lot of you guys, if you are in anatomy or biology, you probably already know a word in Spanish, you just didn't know yet. And that's one of the things that I want to change today. Okay? It's important that today we ask ourselves, why is this topic important? Why, from every topic we can possibly think about, why are we here today, and why is this topic important? So I want you guys, by shows of hands, tell me how many of you guys are bilingual. Okay, so that gives us probably like 50%, okay. And now I want you guys to raise your hands to tell me if any of you have done any rotations or volunteer or have ever been in some sort of medical facility where you guys have to interact with medical Spanish speaker patients. Okay, so we just have two. Okay, I want you guys to notice that if you guys going to start interacting with patients at some point in your medical career, you guys are gonna see this discrepancy in people that can interact with the patient. And that's one of the things that we're gonna see today. So if we go to numbers, to make this talk more practical, why is it so important that the healthcare workers or employees speak Spanish? Because only in California, 38% of the population are Hispanic. This is more than a third. And in the US, it's gonna be 13.1% of the US population. There are certain states where there's a higher percentage of Spanish speaker than others. But if you plan or your goal is to practice in California, you have to prepare for these numbers. And it's probably there's something that we don't notice in our day-to-day until we are out there exposed to this and we start seeing that in a medical facility or in a clinic. Another important thing to mention is that nowadays, all the residents, doctors, or even in certain clinics, even medical assistants are being asked or hired whether they know Spanish or they don't know Spanish. Why? Because there's a need from some doctors to be able to translate to the patient or be able to communicate, or even just something as simple as setting up an appointment. And sometimes that is gonna make the small difference in between you getting a job or not getting a job. And sometimes we don't think about those things, but it's important that you guys start looking into the future and your guys' opportunities. Another important difference is that in countries in Europe, most of the physicians speak at least 2 or 3 languages, which in other countries, most people just speak 1. What does this tell us? That is a cultural difference from European countries, where they know that they are other countries so close to them that they sometimes are gonna see a patient that speaks French, or a patient that is gonna speak Spanish, or a patient that is gonna speak English. So what do? They adapt. They adapt to what the patient needs. And they might be other fields where this is not important, or where you don't really need to be involved in that. But if you're gonna be in a field where you're gonna give a service, it's our responsibility, and it's the responsibility we take when we decide to go in a healthcare career, it's our responsibility to give the best treatment and the best care we can provide. And it's our responsibility to adapt and learn whatever we need in order to provide the best care possible. A couple of weeks ago, we had the Spanish Heritage Month. But it's not just because of that we have in this talk. It's because I want you guys to start seeing it as a community need, not just a cultural part, but a community need. And if we give a service, we need to adapt to our community, which is basically what public health does. So basically that will be part of doing public health. And this also takes us back to the same question. How can I provide a better care for my patients? And how speaking Spanish is gonna help me connect with my patient. Because specifically in Spanish speaker patients, it's hard for them to connect if they feel that you don't understand them. Not just only their language or their culture or the way they interact. It's also very common, and you guys are gonna see it once that you guys start seeing patients or clients or whatever type of field you guys go to. There's always a little bit of mistrust or fear in the Hispanic community. It's hard for them to trust someone, especially if they're gonna take care of their health. And we're gonna see a little bit further why this is gonna impact the treatment of the patient. If instead of Spanish, the number said 38% European or Italian, this talk wouldn't be about Spanish. It would be about Italian. And what I want to express with this is that we have to adapt to whatever the community needs. And that's something that I really want you guys to stick with today. It's not just because it's in Spanish, it could be Italian, it could be Chinese, it could be, in 30 years, it could be Japanese, I don't know. But whatever that is, we have to adapt and evolve into that. So what happens if a patient comes into my office and I can't really understand his symptoms? Well, I'm gonna end up misdiagnosing the patient. And if I don't understand what the patient has, I'm not gonna be able to give the correct treatment. So it's always gonna end up being a cycle of misdiagnosis and mistreatment. And what happens with this is that according to some statistics, 30% of Spanish-speaking patients have problems in the reliability of the information the doctor gives them because they don't fully understand what they're being said. And when a patient doesn't really understand, they're not gonna have adherence to the treatment, and they're not gonna follow up with their appointment. This is something very important, and you guys are gonna see it whether if you guys go in law or medical health or in any type of career that, like I said, gives a service. A patient that trusts and feels comfortable with its physician is gonna be a patient that comes and shows up to the next appointment. It's a patient that takes his medication as prescribed. And that can make a lot of difference in the patient. We have another percentage, which is that 30% of the patients that speak Spanish have difficulty understanding the medical instructions that they get. It's usually common to see poor follow-up and surgical or interventional treatments that the patient may need because the patient doesn't agree to follow up with something they don't understand. Imagine this already. Someone that speaks the same language as you, a patient that speaks English and you speak English. The patient is not really gonna understand the disease if you don't explain it correctly, or if you don't try to communicate with them or show them. It's already hard. So now imagine putting a communication barrier by not speaking the same language. another problem that we might see is that sometimes we have interpreters that are not the best at interpreting what we need to interpret. Why is it different that someone that is not in the medical health explains or translates, because this happens all the time. You're gonna see that the patient comes with the daughter that speaks English, or with the niece or the granddaughter. But that person is just gonna translate however they can. But if the physician, if me as the doctor, I explain medically exactly what's happening, it's gonna make a whole difference. And you guys are gonna see it. I see it every day at the office. I see it every day when I have contact with patients. The way their eyes light up when you come and say in Spanish, hola, and they connect with you, and they open their eyes like, oh, okay, now I can take my guard down, and I can communicate with this person. It's very important to be able to connect with the patients, to understand what are the most important points in the Latin American culture. Family and religion. You guys might think you don't have time for that, or it's too much to ask the patient if they have kids, how they're doing, because something that the Hispanic culture is very proud about, it's about how they've been hard workers, and now their kids or grandkids are the first generations in going to college. Sometimes just making a small comment that makes them feel that you care about them is gonna make a difference. Also, another thing that is very important is religion. Because as we know, historically, most of Latin America was a colony of Spain for over 100 years. So Catholicism is very, very deep in the Hispanic culture. That's why it's important sometimes to, when we're leaving the room or when the patient is leaving, just say, God bless you. Dios lo bendiga. Some people might be Catholic, some don't, but it's a cultural thing to say, whether you are religious or not religious. It's part of the culture to say, God bless you in Spanish, which it means, que Dios lo bendiga. Another thing that it might be the most important part of the talk, and if you guys just keep this, that will be my goal completely. You guys can go and take a Spanish course online, in person, everywhere. But they're not gonna teach you the correct way to actually talk to elders and patients. In Spanish, we have formal and informal. And to the patient, we always talk formal as a way of respect. It's not gonna be the same if you talk informal as if you do informal. And that is what I want that each one of you guys take from this course and make a difference out there. Because that's gonna differentiate you from your coworker, okay? And the two ways we do that, it's with usted. Usted is for formal, and tú is for informal. So to every elder and every patient, it doesn't matter what age, we always talk formal. And unconsciously, that's gonna tell the patient that you understand their culture and that you respect them. And that is something that you guys are not gonna see in a textbook or in a class online. That's why it's very important that you guys pay attention to that difference. I'm gonna put a few examples. How are you feeling in English? In Spanish, we have two ways of saying it. ¿Cómo te sientes? Which would be the informal, like if you're talking to your friend. Or we have ¿cómo se siente? ¿Cómo se siente? Is the formal. And that's the correct way to say it. Another example, it would be, let me take your vitals. How do we say it formal? We say, permítame tomar sus signos vitales. this little difference, it's very important. A lot of the times, all that we need to know is that se and te, because that's something that we're gonna be using in different scenarios. So that's the only part that you guys need to learn today at least. Something that we're always gonna use in our day-to-day, some parts of it, even if you guys don't go to healthcare, it might be useful for you guys. And it's good morning, my name is, and I'm your doctor, nurse, and I'm gonna be taking care of you today. Buenos días, mi nombre es Kelly, soy su doctor y voy a cuidar de usted. We always need to make emphasis in that we are gonna take care of you. The patient needs to feel that you care. They're not just another number on the bed. So how can I take care of you? Because at the end, that's supposed to be the reason why we go into healthcare. Because we have a call for service. Now here, I'm gonna need you guys to participate a little bit. Yeah, we don't need to know all the alphabet to be able to speak Spanish. So I'm gonna try to make it super simple, and that's what I wanna show you guys with. If you guys learn these 3 letters, everything is gonna be so much easier. You guys don't need to know the whole alphabet. These 3 letters are the ones that usually make the difference. It's kind of tricky, you guys will see why. The A in Spanish, it's A. The E, as we know it in Spanish, it's A. And the I, as we know it in English, it sounds like an E. So that's tricky, 100%, because we have to reset our brain into, instead of calling the EE, calling it A, and instead of calling the I, calling it E. So that can be tricky, but these are the only 3 letters that are gonna help you so much. So if you guys can go with them or go through them in your personal time or whenever you guys have time, that will help. Because like I said, you guys don't have to go full into the whole alphabet. These 3 letters are gonna make a difference. So now, I'm gonna say the letter out loud, and I would like you guys to repeat it after me so that we can practice, okay? So the first one, it's gonna be A. Okay, I didn't hear you guys, so I'm gonna say it again. The first one is A. Perfect. The next one is gonna be E. Okay, we're gonna say it again. E. Perfect. And the third one, it's gonna be E. Okay, we're gonna say it again. E. Perfect. Yeah. I know these 2 are very tricky. And you guys are gonna see in the next examples, we're gonna see why this matters. One thing that you guys are gonna see all the time is gonna be medical history. And certain phrases or things that you guys are gonna see all the time. It's name, which is nombre. What's your name, which is cuál es su nombre. Date of birth, fecha de nacimiento. Symptoms, which is síntomas. You guys can start seeing here how there are some similarities in some letters or the form of the word symptoms and síntomas. Yeah? And then we have one that is very important. It's very, very important that you guys learn how to say pain in Spanish. Dolor. Because that's one of the most common words you're gonna hear every day if you guys go into healthcare. And doctors, sometimes we have to be as detectives. We always want to know why, how, when, where, and that's something that is always going to be in the medical history. When did the symptoms start? How did they start? Is there anything that makes it worse or makes it better? Or probably, I'm sure that everyone has heard this one, From 1 to 10, how would you describe your pain? Every time we hear that phrase. So, if we already know that these are things that repeat themselves, these are things that we need to learn. When did your symptoms started? ¿Cuándo comenzó su? And then there, we can apply a list of symptoms that we're gonna see next. What symptom are we gonna put in that line? And then, is there anything that makes your symptoms worse or better? ¿Hay algo que mejore o empeore sus síntomas? And from 1 to 10, how would you describe your pain? Del 1 al 10, ¿qué tan fuerte es su dolor? Dolor. I want you guys to keep that word. So some common symptoms that we're gonna see. And I find this slide interesting, because as you see, nausea and nausea are pretty much the same. So guys, you already know how to say a word in Spanish. You guys didn't know that. Bravo. Okay, another one, diarrhea. Diarrhea, same thing. Fever, fiebre. Cough, tos. And I'm gonna show you guys a very easy way to learn how to say cough. Because if you say tos, it sounds like you're coughing. So when you cough, you go tos, tos, tos. So you guys are not gonna forget that one. And it's very important when you guys see inflammation over there, inflamación. This is another tip that is very important for you guys to remember. Most of the words in English that finish in T-I-O-N, in Spanish, they're gonna end up in C-I-O-N. And the first part of the letter of the word is gonna stay exactly the same. An example, inflammation. Inflammation and inflamación have pretty much the same form. It's just till the end where they go to sion or tion. And that's important because you guys gonna see that pattern over and over again. So what do I want with this? I want you guys to know that you guys can predict how a letter is gonna be written or say in Spanish just by knowing this. For example, something not medical, just something that comes to my mind. Convention, and it's in T-I-O-N. Oh, if Dr. Kelly told us at the talk that it ends up in T-I-O-N, it's just gonna end up in C-I-O-N, okay, I already know how to say convention, it's convención. And we can keep going all day with words that end up with T-I-O-N. What I'm trying to do is just make it easier for you guys. Because you guys probably already know 100 words in Spanish, and you guys didn't know that till today when I told you about this. Vital signs. These are very important. I'm not gonna go into the details of how to read them and stuff like that because that's completely for a different talk. But I just want you guys to get familiar with how it's gonna look like written down on paper. So for blood pressure, it's gonna be presión arterial, which it would translate directly to arterial pressure, but in English we use it as blood pressure commonly. Temperature and temperatura are pretty much the same, very similar. Heart rate is frecuencia cardíaca, where frecuencia means rate, so we're also gonna use it with respiratory rate, frecuencia respiratoria. And then we have blood oxygen levels, which stands for saturación de oxígeno. Most of the times, the way you guys are gonna see it in hospital, it's gonna be in abbreviations. So I just want you guys to look at it pretty quick. So it's gonna be P for blood pressure, PA in Spanish, HR, FR, respiratory rate, frecuencia respiratoria, and oxygen saturation. If you guys ever do any rotations, or if you guys start going into practice or internships, this is something that can be useful for you guys. Another common terms that we use day to day that are very similar, it's dialysis. How do you say it in Spanish? Dialysis. So it's pretty much sounds pretty similar. So if the patient comes over and you don't know how to say dialysis in Spanish, so you're hesitating, but you remember, oh, when Dr. Kelly gave the class, she said that it sounds pretty much the same. If I try to say dialysis, probably the person is gonna understand what I'm saying, okay? And another important difference, and this is why learning AEI was important, is because in basically medical sciences, there's so many different words where we need to apply hyper and hypo. There's so many things. Hyperglycemia, hypoglycemia, hypotension, hypertension, 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 hyperglycemia. Why is this important? Because they sound pretty much the same. And like I said before, they all are part of the word. Like in here, glycemia, it spells exactly the same way in Spanish. And that's something that you guys are gonna see very often. It's a pattern. So I want you guys to learn the patterns, because like that, you don't have to memorize so many words, because you already know the pattern. So you don't have to memorize 100 words if you know the pattern. So in English, it's gonna be hypo, hyper, and in Spanish, it's gonna be hipo, hiper. Because like we said before, I in Spanish sounds like an E. So it's gonna be hipo, hiper. And I want you guys to repeat after me. Hipo,
Hipo,
hiper.
hiper.
Perfect. And basically what we've been seeing is the importance of the Latin roots in medicine. Because at least all the medical procedures that end with a Y in Spanish are gonna end up with an IA. Like I said, another pattern that we can use in so many different surgeries, treatments, interventions. More specifically, the Latin is important in anatomy. Mostly all of the anatomical vocabulary comes from Latin. And from the Greek, we're gonna have all the suffixes that we have been seeing, like tomy, ectomy, which is basically resection of. And now we're gonna see some examples. So same here. We're gonna learn a pattern. We don't need to analyze or remember how to say 100,000 words. If we just remember the pattern, we can already know so many different words in Spanish. So just remember, Y in Spanish, it's gonna be IA. The first example is surgery, cirugía. Colonoscopy, colonoscopía. Cholecystectomy, cholecystectomía. Radiography, radiografía. Tomography, tomografía. So it sounds super easy. It sounds pretty easy because they all come from Greek. So we just remember that little tiny detail. You can just brag about, oh, I already know how to say so many different things in medical Spanish. And just an example here of colonoscopy comes from Greek colon, which is gut, and scopion, which means look at, which is basically when we open the abdomen to check exactly what's happening in the cholecystectomy. And in the colonoscopy is when we introduce the camera to see how the colon looks in the insides. How can I make my patient feel more comfortable? Remember that usually, at least 99% of the patients that show up to your office and are in front of you, they are sick or they are cursing through a disease. You're usually not gonna see the healthy patient that comes for prevention. It happens, but it's weird. Doctors, we wish it would be like that, but it's not. So the patient that is in front of you is probably having the worst situation of their lives. It's a sick patient. Can you remember right now the last time you were sick and how you felt? So that's how the patient in front of you probably feels. Wouldn't you like someone to try to make you feel at least more comfortable or try to make your symptoms go away? So that's why it's also important, always ask, how can I help you? En español, in Spanish, is ¿en qué puedo ayudarlo? How can I make you feel more comfortable? ¿Cómo puedo ayudarlo a sentirse más cómodo? At the end of the presentation, I'm gonna pass over a piece of paper where whoever is interested on having the slides can write down their email and I'll have them sent to you guys. There's no way to describe how important this slide is. Probably the most important one on the presentation. Physical contact. In the Spanish community is one of the most important things to establish trust. You guys have no idea how hard it was for me, at least the first couple of months when I moved here. I've been living in the US for 2 years almost. For me, it was very common to approach and try to give a kiss on the cheek and hug. And everyone would be like, oh, whoa, wait, what's happening? Or it would make them feel comfortable. You could see it on their face. And for me, it was like, what did I do? What's wrong? Well, for me, that was the most normal thing. So now I just go with a handshake, which is exactly what happened when I say hi to Itzel today, because I'm so used to that now. But this is a factor is so important. And I'm not gonna ask for people to try to change their culture and start giving a hug and a kiss on the cheek, because that's not practical. But simple things like shaking the hand of your patient or a soft pat on the back as they're leaving the room or when they arrive, those small little things of physical touch can make a difference. Because obviously we still wanna keep it professional, but we wanna make the patient feel comfortable. Shake of hands, pat on the back, especially if they're elders. Always, of course, and never forgetting, washing your hands between each patient, okay? Because we always have to keep all the guidelines correctly, right? And now when the patient is leaving, how can we try to say certain things that make sense to them? For example, it's very common that when the person is an elder, we call them don, which is way to refer to someone that has experience, that we look up to for respect. So an example is we have a patient, Jose, and I say, hola, don Jose, how are you? That's all you need, that's all he needs to hear. He probably doesn't even need you to speak Spanish fluently, probably just by saying, hola, don Jose, how are you? He's gonna feel that you care. How do we say get well soon? Que se mejore pronto. And here I want you guys to see the difference if I say que se mejore pronto, which is the formal, and say que te mejores pronto. Because if we say it with T, it would sound like you were saying it to a friend. So that's why that's important. So always remember that it's SE instead of T. Hasta luego, pretty much almost everyone knows this one, which is until the next time. And goodbye. Adios. I would like you guys to, I'm gonna try to set up an example of how I would approach it. When the patient walks in, shake hand. We can probably use what we just read there, like, hola don, ¿cómo está? How are you doing? And as they're leaving, when we walk them through the door, we can do the pats on the back. And that's also important. Doesn't matter how busy we are, we always have time for our patients. and we try to walk them to the door. And it's hard, and you guys are gonna see it. It's very hard to keep that in mind, especially when you're busy, especially when you're tired. That's why we have to constantly remind that to ourselves. So as they're leaving the room, we say adios. Que esté muy bien, which means hope you are better or hope you get well. And hasta luego, which is until next time. And the most important one is God bless you. Que Dios lo bendiga. This is a cultural phrase. Doesn't matter if they're religious or if they go to church every Sunday or no. Everyone is gonna relate to the phrase God bless you, because for people that means that you are giving them good wishes. That's why it matters. So now, I'm gonna have you guys practice. I'm gonna pass over a couple of this. For the next slide, we just need to put I-A. Like that. Yeah. And then it was good morning, God bless you, fever, inflammation, and blood pressure. So just to close, there are a few points that I want to end up with. It's important to always empathize. Part of wanting to learn this terminology is wanting to empathize with the patient. How would I feel in this type of situation where I'm in a country where I don't understand what my doctor is trying to tell me, or where I cannot communicate what's wrong with me, where I cannot really tell the doctor where does it hurt, or how long has it hurt, or how would one in my family members feel in this situation? How would your grandma feel? She's in pain and she cannot express it. So always remember to be empathic. And also, it's also important to be patient. Very, very patient when we don't understand someone else's language. Be kind and try to use available resources. Now we can use internet. There are a lot of plastic models like this that can help us try to explain something to a patient, even if they don't really understand what they're saying. If you show them, it might be easier for them to understand. So try to use all the available resources you guys have. You probably right now more available resources than I do, because you guys are in the technology era. And just to finish, I would like you guys, the young lady from the first row, I would like you to read out loud this phrase for me, please. For
The
us.
best way to find yourself is to lose yourself in the service of others. And that's by Gandhi. I can never say his first name.
Just always remember that if you guys go into any healthcare career, the main reason why we do it always has to be a call of service, because there's nothing else that is gonna motivate us as much as that for such a long career as it's becoming a physician or becoming a nurse. So that's it. Thank you. I want to ask if any of you have any questions. Any questions? Yes?
What would you say are like the main differences, like one or two, between practicing medicine in Mexico compared to the US? I know you've been exposed to it a little bit here. Are there any like major differences that kind of stick out to you that would be notable?
In patient care, like interaction, or
Sure.
like treatments and stuff like that?
Whatever, whichever's better to answer.
There's a huge difference in the type of relationship that usually a physician in the US or a Latin American physician. It's usually way less contact. Usually everything is very straight to the point, very, what we would consider practical, yes. But I think that only works in certain communities. that definitely doesn't work in Hispanic community. I think that will be one of the most
So would you say
important points.
bedside manner, maybe that term is different,
Yes.
right? It's
Yeah, definitely the bedside manner. And also, I think that medically it's important to ask more questions to your patient and know more about them. Because the more you know about your patient, if sometimes even personal questions, the more likely is that you find out what's happening with this patient. Sometimes, example that comes to my mind, there's some lung pathologies that you get them from bird drops. So sometimes just talking to your patient of something as silly as if they have like pets, what are the name of the pets and stuff like that, can help you rule out of not if it's a fungus infection from that type of that part of microbiology.
Also for cats.
For cats, exactly for cats. Sometimes it's even the area of the city you live with. The area of the city where you live can also determine sometimes if you're more exposure to certain things, if you're more in an area where the houses are old, because that's something also a risk factor for lead poisoning. Another thing that comes to my mind is like if you're close to factories or more pollution, or you're close to water. If you travel, sometimes you're just asking like, oh, I just went on vacation, and they're there and they're sick, and they're like, oh, I just went vacation with my grandkids. Oh, where do you guys went? Oh, we went to this place. Okay, that makes me now think that maybe what you have is this parasite that you get from water, or that you get from a hot tub, or that you get from ventilation. Certain things like that we need to go further, like we need to ask a little bit further to be able to get the answers we're looking for.
thank you.
Any other questions?
I just want to emphasize how important is the cultural background. Since a couple of years back, sometimes I work for UCI for the medical school for our medical students, right? And I don't know, I feel that they have emphasized a lot how the care of the patient is, especially with minorities. And we use sometimes technology. They make us to wear like the Google glasses, so we can record how the doctor, or in this case the student, medical student, react, right? I'm the patient and I use the glasses so they can see the reaction. So imagine that you're the doctor and you come and you tell me, oh, you're gonna die in the next 3 months. And some of them, because I'm recording, right, they say like, oh, I'm so sorry, you're gonna die in 3 months. But I have other students who hold my hand and say, I have to tell you this, it's gonna be very strong, but this is gonna happen very soon, right? All these little details, they have been in the last years more important. And I don't think we do with minorities, but I think should be for any kind of patient, right?
100%.
That how the interaction patient, in this case, doctor, have to be working. And we have in a room with 360 camera, still we have the glasses, and later the doctor called the student, right, with the patient that I'm technically an actress there. We express how we feeling. Right, and we say, well, he just told me you're gonna die. Like, how you wanna expect the guy feeling, right? And it's very different when you prepare the situation, you can hold the patient, you can have, it's nothing wrong to extra if you wanna say this kind of words because you are never prepared for bad news. So if the doctors say it, right, and now we do a lot of things with our students because it's not that they have been not humanized, but they kind of lose that during the school. They are very focused and they need to pass the test, they need to memorize this, that they lose the human part. And the human part should be more important as the knowledge too. And that's what we teach them how to use a translator, right? Always looking to the patient, never in the translator, because the feelings how the translator is gonna say, oh, I have super strong pain. But if you look into the patient, you can see the expression into the patient. Just very, very true, like, the translator is never gonna express the emotions of the patient. That's what we always need to look into the patient as a professionals in the health. But thank you so much.
No, thank you
Dr.
guys
Kelly's
for
gonna be
having me.
working for us next semester. She's gonna be in the anatomy. Many of you I know that they are not related to this, but she's gonna be working with us in the anatomy lab. So she's gonna be spend more time here, so you guys wanna be working or talking to her. Hopefully she's available for us and you guys can ask more questions. We have and Joey can say, that's what I wanna say, we have students, and so said somewhere there, we have students who we do mission trips, medical mission trips, so there are need to get embed into the culture and the language in one day.
Yeah.
And it's a different experience. And again, that's what I say, this is gonna happen to you, because we have a lot of patients that they don't speak English. So just feel comfortable, because this is gonna happen a lot. Which I think it's not easy, but you start slowly getting there.
Yes. And another thing that is important to mention is that the Spanish speaker patients, they don't need you to speak fluently English. If you just like try, if they see you that you're trying, that's gonna be enough for them. Like just the physical contact that we talk about, like the little phrases like Don Jose, little things like that, it's gonna make the difference. I'm telling you, I see that every day. Any other question? Well, thank you guys all for coming, and I hope you guys